Hi, my name is Dr. Joe Utash.
Dr. Joe.
It's been 15 years since I started getting adjusted for severe low back pain. It's been 12 hours since my last adjustment. I currently get adjusted for just better overall well-being, more energy, better sleep. My body functions better.
Thanks, Doc.
Thank you for sharing.
Hi, I'm Dr. Jeff Button.
Hi, Dr. Jeff.
Button.
I started getting adjusted in 8th grade after a bad wrestling tournament, and now I get adjusted daily, sometimes twice daily if I can help it. Really gives me better clarity and overall health and less joint pain. It's been 1 second since my last adjustment. Thanks, I'm Dr. Jeff.
Thank you, Dr.
Thanks, Dr. Jeff.
Hi, my name is Miguel.
Hi, Miguel.
It's been about 16 hours since my last adjustments. Kind of needing one now, but I've been getting adjusted for the last 6 years. And I really started getting adjusted for low back pain due to lifting weights incorrectly. I no longer have to deal with low back pain, and I can go to the gym and have enough energy and get those gains.
Thanks, Miguel.
Thanks for sharing, Miguel.
Hello, my name is Priscilla.
Hi, Priscilla.
Hi, Priscilla.
I have an addiction to adjustments. I've been getting adjusted for the last 2 years for hip pain, and I have a problem.
Thank you for sharing.
Thanks for sharing, Priscilla.
Hi, my name is Cherry.
Hi, Sherry.
I first started getting adjusted for bad menstrual cycles, and ever since I've been getting adjusted, they have been more calm and more regular, and it just makes my life a lot easier.
Thank you.
Thank you for sharing.
Thanks, Sherry.
You're welcome.
Give everyone a
Yes,
round.
Dr. Utash here, Wellness Key Chiropractic. You've already hurt your back, you're feeling it, it's keeping you from doing what you want to do, whether it's work or play or home improvements. You've already started using the ice, you're doing the spinal molding, the rolls for at least 20 minutes, a couple times a day, and the curve of the low back and the neck. What else can you do? Ginger, turmeric, green drinks, anything with a lot of enzymes that's going to help break down the inflammation, reduce the inflammation naturally. It's going to allow your body to heal itself faster. Use the ginger, use the turmeric, take the green drink, do it a lot, and that'll help you get over your back pain quicker, naturally. If you're like a lot of Americans right now, a lot of time in front of the computer, on the phone, posture is really starting to suffer. You know, the head starts to go forward. Every inch that head goes forward is an extra 10 pounds of stress on that neck, pulling on those nerves that go into the shoulders, into the arms and hands and fingers. A great relief of some of that pressure on that posture and on those nerves is every evening at the edge of your bed, do some of those wobble exercises. So twisting, side to side, and front to back. I recommend 15 in each direction. And then lay on your bed, top of your shoulders on the bed, and then let your head just kind of relax off, and your arms with maybe water bottles just opening up the chest and shoulders. Start with 30 seconds, work up to 5 minutes, and that's a great way to open up the neck, the chest, the shoulders, your posture, taking the stress off your spine and off those nerves. Hope this helps. Dr. Utash, Wellness Key Chiropractic.
My name is Zach. My mom has been coming here for about a year now. I love chiropractics because it's actually given me some great relief from all the weightlifting and training I do. I'm studying to be a personal trainer right now, and I'm looking forward to helping you with your rehab back in this area and also making this entire process just a whole lot smoother and nicer.
Oh, you caught me. It's allergy season, right? And oftentimes that means like a raw nose, the green 11s, the stuffy head, things are just irritated. If you're like one of the other 50 million Americans who suffers with allergies every single year, that could be you. I'm going through this next couple of months of simple, natural, and effective things that you can do to help with some of those allergy symptoms without resorting to medications, which can be unsafe and unnecessary. One of those things is putting coconut oil in your nose, right? And so this sounds weird, it sounds disgusting, and it is if you don't wash your hands. But if you take some of that coconut oil and you just kind of lube the inside of your nose holes there, the nostrils, it really kind of coats the areas that are raw and maybe irritated, and it adds an extra layer of protection. So if you know you're gonna be playing outside and it's windy, or you're gonna go to a grassy area where things are blossoming and blooming, coconut oil in the nose is a fantastic resource. It's very inexpensive, very effective. I just encourage you to wash your hands afterwards. Again, I'm Dr. Joe Utash, Wellness Key Chiropractic.
Hello everyone, my name is Priscilla, and I'm very excited because you guys have seen me in the past, and now I'm completing my medical assistant program, so you will be seeing lots more of me, and I look forward to helping around clean, making sure the office looks nice, front office, back office, and the rehab area, doing some exercises with you guys, so I'm very excited about that, and I can't wait to be part of the team. Thank you.
A lot of people are curious, how can a chiropractor, and especially in our office, see a patient and adjust them full spine in 1 to 2 minutes? And it just seems crazy. Like when you go to a normal doctor, you might be in there for an hour or so, most of that's gonna be waiting, but by the time you get there and leave, and most of our patients are in and out of here in 15 to 30 minutes, and that's doing rehab after the adjustment. How does 1 to 2 minutes work? Well, the goal with the adjustment is by doing the exam, getting the history, setting up the goals, taking the x-rays. When you come in here and sign in, those x-rays, the history pulls up on there, so we can look at the goals very briefly. We can take a look at the x-rays. We're able to see what needs to be adjusted, what doesn't need to be adjusted. I can do a quick assessment of the spine, have you lift the legs, go all the way up the spine, see what's moving, see what's working, see what's not working. Adjust the areas that are stuck, that are subluxated, that are putting stress on those nerves, remove that stress, all in about a minute or two. Because the adjustment doesn't heal you, the adjustment allows your body to heal itself. And so it's really the detection of those problems, those subluxations, removal to the best of our ability of those problems, and that allows and sets up your body to heal, and then you do the rehab to help stabilize and strengthen it, to help you hold that adjustment, which speeds up that healing process. I hope this helps. That's why we're able to get such amazing results in 1 to 2 minutes on the table. If I were to ask 100 people, are you healthy? My guess is that 99% of them would say, yeah, I'm healthy. But do you think that 99 out of 100 are actually healthy in this country? Of course not, right? What do you think they're basing their health on? They're basing their health on how they feel and maybe a lack of a certain diagnosis. But we know, if we look up health in the dictionary, health is 100% function of your body, physically, mentally, spiritually, and socially, not just the absence of sickness or disease. And so if you really want to be healthy, your body needs to be functioning close to or at 100%. And that's why we look to the nervous system, which controls all function of the body, to keep you healthy. That's why many of our patients have had hundreds of adjustments over the years in our office to take stress off their central nervous system so their brain can optimally communicate down the spinal cord, which is in their spine, out those nerves to organs, muscles, and tissues. And when communication is better, health is better. Hey guys, Dr. Joe Utash here. For those of you guys that don't know me, the reason I'm a chiropractor is I had horrible, debilitating low back pain. In my young 20s, after sports in college and in high school and living life hard, I could barely even walk, miserable. Went to my family doctor like most of us do, got the shots, took the drugs, wasn't getting any better, still having multiple episodes. Finally found a chiropractor, really took the x-rays, took the time, found out what was causing the problem, and we actually started working on the cause rather than just covering the symptoms. Inspired me, went to school, got my doctorate, became a chiropractor. Now, hopefully I can do the same thing for you. Change your life naturally. Dr. Joe Utash, Wellness Key Chiropractic.